Hi everybody, my name is Ellen Maroon. I'm with Advanced Massage Therapies in Carrollton, Georgia. And today I want to talk to you about the top 11 mistakes to avoid after plastic surgery. Stick around for the 11th one. It's the most common one that I see and it will really surprise you. All right, so let's get started. Number one, not researching and finding a qualified massage therapist for post-operative lymphatic drainage therapy. Properly trained therapists are not a dime a dozen. They're actually pretty rare. Your therapist needs to have graduated from a minimum of a 40-hour program to preferably a 100-hour program. And that needs to be all live training. This is not 40 hours of random entry-level classes. This is an actual program. So do your research, ask lots of questions about their training. Was it live? How much post-operative training did they get? You need to ask lots and lots of questions. I will be doing additional videos on how to find a qualified therapist and all the questions to be asking them in other videos, so stick around for those. All right, so number two, not budgeting enough for your post-operative care. Finding a qualified lymphatic therapist who's able to do the work is not going to be cheap. Anyone who's charging $95 or less is probably not a qualified therapist. You really need to be budgeting $190 to $200, $250, $300 per session for a qualified therapist. You're going to need, if you're getting, let's just say you're getting lymphatic drainage for 360 lipo and a BBL, you're going to need a minimum of 8 sessions. I often see clients for 12 to 15 sessions after surgery. So budget appropriately. It's going to take about 30 to 40% of your actual surgery budget to be properly budgeted for post-op. All right, number three. Number three, waiting until after surgery to schedule your massages. Please schedule your massages as soon as you know your surgery date. Qualified therapists are often booked up months to weeks in advance, and so do not wait until after you get back. Scheduling ahead is going to get you in with a qualified therapist on a regular basis to get you the proper care you need. Number four, wearing your foams and boards according to how your physician tells you to. They're going to help you heal properly, and not wearing them could cause uneven healing. It could cause permanent dents and dings. It could cause additional swelling. So you really do need to be wearing your foams and boards according to how your doctor told you to wear them. Number five, I commonly see this one a lot. That's wearing a faja that's too tight or too loose. You need to wear your faja properly fitted. Again, a qualified post-operative therapist is going to know how to check for that. Your physician's office, the nurses there, they're also going to know how to check for that, and they're going to be able to instruct you on how to be able to go from your stage 1 garment and when to go to your stage 2 garment. So please make sure you're wearing your faja. If it's too tight, it's going to be causing pinching. It could restrict your lymphatic flow and cause you not to heal as efficiently as you may want to. Also, if you're wearing a faja that's too loose, it's not going to give you the support you need, and you may have additional swelling. So wearing a faja that's properly fitted is crucially important. Okay, number 6. I see this one a lot. Assuming that swelling is your enemy. Swelling is not your enemy. It is part of the natural healing process. So be patient with yourself, be patient with this healing process. It takes much longer than most people anticipate. Number 7, overdoing massages in the first week. A lot of people are going to do more massages than is necessary in the first week, thinking that that's going to speed up the healing process. But that is not the case. Get 2 to 3 massages in your first week. I really recommend 3 massages in the first week. Your second through your fourth weeks, 2 massages a week, and then you're going to need 1 massage a week, depending on how you're healing for the next 2, 3 to 4 to 5 weeks. Everybody heals differently. Everybody's surgeon was a little different. Everybody's body was a little different. All the little processes, they were all a little different. So the healing process is different for everybody. Number 8, not getting enough massages. So again, that goes back to not properly budgeting for your massages, and maybe you're trying to skimp in on it and, oh, I really can't afford it. Please budget for those. You need to be getting 3 massages ideally in your first week post-op, and then 2 massages a week for 4 to 6 weeks after, and then 1 massage a week until we have determined that you're okay to go. All right, number 9. This is one that can really cause problems. That is wearing a waist trainer too soon. I know you're anxious to get out of that faja. You think the waist trainer is going to help you get snatched and tighter a lot sooner, but you need to wait 3 to 4 months before you get in that waist trainer. It can cause permanent denting and cause you not to heal properly. So please be patient with yourself. This is a healing process. Wait 3 to 4 months for that waist trainer. Number 10, relying solely on your fajas and massages for your healing process. You need to be watching your water intake, your diet. Really watch your salt intake. In fact, I recommend you start watching your salt intake months before your surgery. Start adjusting your taste buds and learning how to live on a low sodium diet. Every time you're eating salt, you're going to be retaining water. So maintaining a good, healthy diet, that's going to include a lot of proteins. So you're going to need that to help build your body back up and heal. So don't rely solely on your fajas and your massages just for your healing process. Nutrition and hydration and rest and patience and taking care of yourself is absolutely critical. Okay, and are you ready for the last one? This one is the most common mistake I see. That is not getting pre-operative massages. Yes, you need to have 2 massages before your surgery. Think about this. You're going to clear out all of your stuff in your lymphatic system before surgery. So most people come to see me, they've never had lymphatic work done before, and most people have clogged lymphatic systems. So then what I'm trying to do is I'm trying to clear out all of the old stuff and all of the stuff from the surgery, which is a tremendous amount. It's quite an overload to the system. So I highly recommend a couple of weeks before your surgery that you make at least 2 appointments so that we can get in and clear your tissues and clear your liver and get your massages so that your lymphatic system is flowing, functioning properly, and then when we deal with your post-operative work, then that's all we're having to deal with. Your massages go a lot better, your healing process is faster, and it is super amazing if you get that done. All right, well, I hope these tips really helped you out. And again, my name is Ellen Maroon. I'm with Advanced Massage Therapies. If you think this is helpful, please give it a like, subscribe, follow. I'm on YouTube, Instagram, and Facebook. Thanks, and I look forward to seeing you guys more. If you have any comments, please drop them down below. Would love to hear what you think. Have a great day.